released instructional video on how to change a peritoneal dialysis transfer set. First, gather your supplies. Supplies you would need would be sterile gauze, a new bottle of iodine, a pair of blue hemostats, sterile gloves, a PD mini cap, and a Baxter mini cap extended life PD transfer set with twist cap. Indications for changing a transfer set would include if the patient's transfer set is damaged, has a hole in it, or is otherwise not working, or if the patient comes to the hospital with a transfer set that is not compatible with our dialysis machines. First, lay out a sterile drape once you enter into the patient's room. Make sure there's a sterile procedure sign on the door, that you've washed your hands, donned clean gloves, and that you're masked and the patient is masked. If there are visitors in the room, they should be wearing a mask as well. Outstretch the patient's catheter after you untape it from their belly and lay it onto your sterile field. Using the pair of blue hemostats, clamp off above the site of the connection on the patient's actual PD catheter. Next, open your pack of sterile gauze. And using a new bottle of iodine, break the seal on the bottle and generously pour the iodine over the gauze. You're going to take this stack of gauze and wrap it around the site where the patient's catheter connects to the transfer set. Wrap it up and then use paper tape to tape the gauze so it'll stay. And you're going to leave this for about 10 minutes. Note that it's okay to be wearing clean gloves, not sterile gloves, during this phase of the procedure. If leaving and entering back into the room, ensure that the sterile procedure sign is back on the door and that you've washed your hands. Again, everyone in the room should be wearing a mask. Open up your new transfer set and lay it near your sterile field to get it ready to attach. At this time, you can don your sterile gloves. Once your gloves are on and you're ready, you can remove the iodine-soaked gauze from the patient's catheter. Then, using a new sterile gauze, dry the area that was soaked in iodine. You can then twist to disconnect the patient's catheter from the transfer set. Pick up the new transfer set, take off the cap, and twist the transfer set onto the patient's catheter. You can continue to dry using sterile gauze. Clamp the transfer set, and using a new sterile mini cap, replace the end of the transfer set. The one that the transfer set comes with is not impregnated with iodine, so this one is, so we want to use that one. You can then tape the catheter back up, if that's the patient's preference, and then unclamp your hemostats.